Hello, I am Dr. Diane Wrisley. I'm a professor of physical therapy in the Doctor of Physical Therapy program at College of St. Mary. Along with my co-authors, Eder Garavito, Brittany Jones, Tamara Clintworth-Kirk, and Ashley Poole, we performed the study, Motor and Sensory Balance Deficits in Individuals Immediately Post-COVID-19, a cohort study. This was a collaboration between College of St. Mary, Duke University, and Duke University Medical Center. We came up with this idea because we knew that individuals with pulmonary dysfunction, especially COPD, had balance deficits that may be related to respiratory function. Since COVID is a respiratory dysfunction or presents as a respiratory dysfunction, then we thought maybe that they would have balance deficits as well. We also know that patients with COVID-19 do have neurologic dysfunction, and so we thought that might be a contributor to the balance dysfunction. So what we did is we had 25 subjects who completed the study, and what they did is they performed the timed up and go, the activity-specific balance confidence scale, and the modified clinical test of sensory interaction on balance. These patients were immediately after their COVID-19 restrictions were lifted, so in acute care. And most of them, it was immediately before discharge. We had difficulty recruiting subjects because of how quickly patients were discharged. There wasn't time to actually test them. And what we did is we performed these 3 tests, and we also monitored respiratory function before, during, and after the data collection, including respiratory rate, blood pressure, SpO2, and the use of oxygen. So what we found was that 88% had abnormalities on the activity-specific balance confidence scale using a cutoff of 80%. All of the patients had abnormal scores on the timed up and go using an 11-second cutoff for adults over the age of 65 and an 8-second cutoff for adults under 65. We had 48% of the subjects had abnormalities on the condition 4 of the modified clinical test of sensory interaction on balance, which is the condition where they stand on foam, eyes closed. So we found that they had motor deficits based on the timed up and go, and difficulty using vestibular information for balance based on the modified clinical test of sensory interaction and balance. We found no correlations above 0.5 between the respiratory function, the demographics, and the balance tests. So what we concluded was that people post-COVID-19 acutely do have balance deficits, and they have both motor and sensory balance deficits. And how this relates to the clinic is that therapists should be aware that these deficits are there and they should be addressed, especially their perception of balance as well as their use of vestibular information for balance. And so we recommend that they do look at the vestibular dysfunction. And so this was something that had not been shown before, and we think it is valuable for the clinic. Thank you for listening. We appreciate you listening to this video as well as reading the paper. If you have any questions, you can contact me at the email address on the article. Thank you so much.